As coronavirus cases continue to rise, more people have dealt with anosmia, which is the loss and inability to smell, with inability to smell or taste. It's a telltale sign of COVID-19, and sometimes it's the first and only symptom of the illness.
In this week's segment of Center Solutions COVID Edition, Melanie, Saiz and Kristi explain how anosmia can impact more than just your senses. Edwards says she had the virus last year and knows what it's like.
Whenever I first found out that I had COVID, was mostly asymptomatic. But I realized that I had a candle that usually burned really strongly that I burned in my living room, and I noticed I could not smell that very much. So, I mean, it's just not as intensely. But, and I only had it for a couple of days. Now, in comparison to that, my husband had it for several weeks, and he said he felt very off balance.
Edwards says that when people lose their sense of smell or taste, they are concerned on when they will get their senses back, and the fear makes everything worse.
That's why anosmia itself can take a toll on your mental health.
Olfactory research has been going on for decades, but hasn't come to light like it has recently. So nobody really knows when their normal will return. So that's a little frightening for people. For the minority of patients who have not found their senses return, there's a quality of life issue. I mean, smell is linked to taste, which is a part, food, tasting your food, it's a part of pleasure. The sudden absence is like a light switch that's gone off. So that has a profound effect on someone's mood.
And according to Saiz and Edwards, studies have linked anosmia to social isolation and the inability to feel happy.
Both say that memories and emotions are linked to smell, so those impacted may not be able to feel the nostalgia that others can. Edwards also says that smell can trigger or exacerbate eating disorders.
Sometimes if you can't taste or smell, you will eat because you know that you need to eat. But you know, sometimes the taste, being able to taste, is connected to your being able to feel full as well. Then on the flip side of that, people are saying, if I can't taste it and I get no pleasure out of it, then why am I going to eat? And then they learn, they restrict their food. And if there's any connection to an eating disorder or an OCD tendency, that can very much fall into that category of I will just continue to restrict my intake.
And if you have anosmia and are feeling anxiety about it, Saiz and Edwards recommends that you call your physician to see if they have any suggestions or help or relief.
You can also contact a therapist who is trained to teach you coping skills. For more details about anosmia or how to deal with it, head to our website. We'll also have a link to the